This is the Neoliberal Round Podcast. I am Renaldo McKenzie, and we have some news coming in that I would like to share with you. The U.S. pressure on Cuba is harming Jamaica and the Caribbean health sector. Again, the U.S. pressure on Cuba is harming Jamaica and the Caribbean health sector. That's what I want to talk about today real quickly for you guys, because not many of you are not sure what's going on. According to the Jamaica Gleaner, Jamaica is ending its long-standing medical cooperation arrangement with Cuba, a move that is already creating uncertainty, delays, and concern within the health sector. Jamaica's government has said the two sides could not agree on new terms and also pointed to labor and legal concerns in the existing arrangement. At the same time, the broader context is impossible to ignore, because this decision comes amid intensified U.S. pressure on Cuba and Washington's campaign against Cuba's overseas medical missions. In my view, this is not happening in a vacuum. The United States has been pushing countries to reconsider or sever ties with Cuba, including in the health sector, while accusing Cuba's medical missions of forced labor, an allegation many Caribbean leaders have rejected. Reuters reported that Jamaica is the latest country to roll back medical cooperation with Cuba under pressure from the Trump administration, and similar disruptions are now being seen elsewhere in the region. Guyana is also facing a similar problem. The Associated Press reported that Cuban doctors are preparing to leave Guyana after disputes over payment arrangements, again in a climate shaped by U.S. pressure and wider efforts to isolate Cuba. The Associated Press also noted that Jamaica, Honduras, and several other Caribbean countries have been reconsidering how these programs are structured. The Caribbean has long depended on Cuban medical personnel to help fill critical shortages, especially in underserved areas, but also that they have a cooperation with Cuba since they are part of the Caribbean basin. So if Washington's policy helps trigger the collapse of these partnerships, then the United States cannot wash its hands like Pontius Pilate and walk off stage. It has a responsibility to help address the gap its policy has helped create. If the U.S. wants Caribbean governments to end or reduce their medical ties with Cuba, then it should also help provide the doctors, nurses, training, and investment needed to protect healthcare in Jamaica and across the region. I'm Renaldo McKenzie, and I'm just sharing with you a quick note concerning U.S. pressure on Cuba is harming Jamaica and the Caribbean region. Please email us at info@theneoliberal.com. And just remember that the Neoliberal Round Podcast is a 50c31 company. We are now a non-profit. Please donate to us by going to theneoliberal.com and clicking on support so that we can continue to grow. What good?